Hi, I'm Jonah, an active duty Air Force medic. Today, I'll be showing you how to apply a hemostatic dressing with a pressure delivery device, or a PDD, to control junctional hemorrhage. This should be done during the tactical field care phase when the casualty has sustained a wound to the groin, resulting in life-threatening hemorrhage that is not amenable to an extremity tourniquet. These wounds are too high to apply an extremity tourniquet. The goal is to control bleeding by packing the wound with a hemostatic dressing in 90 seconds or less, and to apply an effective pressure dressing to the wound. A key requirement is that you may need 2 tourniquets to complete the maneuver. Consider body substance isolation. If a combat lifesaver is available, direct them to assist. Expose the wound and assess the bleeding source. Clothing may need to be cut away to properly expose the wound. Apply direct pressure to the source of most active bleeding. If not visible, place a fist squarely in the inguinal gutter on the injured side. The inguinal gutter is the crevice between the top of the thigh and the lower abdomen where heavy blood flow structures are located. The location is halfway between the pubic bone and the anterior iliac spine. Using the casualty's J-FAC, remove the hemostatic dressing from its sterile package. If a hemostatic dressing is not available, use gauze or clean, dry cloth material. Remove the fist if used for initial bleeding control and immediately apply direct pressure while tightly packing the inguinal wound with hemostatic dressing until the wound cavity is filled, finishing the packing within 90 seconds. More than 1 hemostatic dressing or gauze may be required to stop the blood flow. If a penetrating object is lodged in the casualty's body, bandage it in place. Do not remove the object. Ensure the hemostatic dressing or gauze extends 1 to 2 inches above the skin. If the hemostatic dressing or gauze does not extend 1 to 2 inches above the skin, place additional hemostatic dressing or gauze. Hold pressure for a minimum of 3 minutes. Reassess to ensure bleeding has been controlled while maintaining pressure. Ensure blood is not seeping through or around the hemostatic dressing. If bleeding has stopped, leave the hemostatic dressing in place while still maintaining pressure. If bleeding has not been controlled and the wound was packed with hemostatic dressing, remove prior packing material and repack the wound. If the wound was packed with gauze, apply additional gauze and apply pressure for 3 minutes until bleeding has stopped. Now, select a cylindrical or spherical PDD and position into the inguinal gutter while continuously maintaining pressure to the hemostatic dressing. Some PDD examples are a shoe or a boot, full water bottle, or a canteen. Next, select a tourniquet that can wrap around the casualty's waist or hip area, or connect 2 tourniquets together. Place the windlass or ratchet tourniquet directly over the middle of the PDD, ensuring that the routing buckle is located toward the medial aspect of the body. Remove all slack from the self-adhering band or strap using a pushing motion across the casualty's body before tightening the tourniquet. Tighten the tourniquet until bleeding has stopped and the distal pulse has been checked and is absent. If bleeding is not controlled and a distal pulse below the tourniquet is present, remove any remaining slack in the strapping if possible and twist or ratchet the tourniquet device until bleeding is controlled and the distal pulse is absent. Visually inspect the placement of equipment, ensuring the PDD is in place and the windlass or ratchet is properly positioned over the device. Document all findings and treatments on a DD Form 1380 TC3 casualty card and attach it to the casualty.